This is the Integumentary System tutorial presented by the SchrDbb reference Atlas of Histology, Function and Clinical Correlation by Dongmei Cui. So we are going to see the introduction of the integumentary system. So the integumentary system generally made up of glands of different structures which consist of the hair, the nails, and three main glands, which are the sebaceous, the eccrine, and the apocrine sweat glands. The function of the integumentary system consists of the protection, 1. Prevention of dehydration, 2. Regulation of body temperature, 3. Somatosensory function, that is sensory receptors are found on the skin, and then 4, 5, you have immunological function because contain Langerhans cells and lymphocytes that play a role in immune response, and the last one, you have production of vitamin G. Generally, the layers of the skin consist of the stratum basale. So generally, the skin is divided into two main skin types. You have the thin skin type and you have the thick skin type. Now, the thin and thick. So for the thick skin type, you have stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. But for the thin skin, so that's at the level of the epidermis of the skin. But for the thin skin, you have the stratum basale, stratum spinosum, stratum granulosum, and then stratum corneum. There is no stratum lucidum in thin skin. Now, that is for the epidermis of the skin. Now, the skin is also made up of the dermis, which consists of the dense irregular connective tissue, and then you have the hypodermis, which consists of loose connective tissue and fatty tissues. Now, the thick skin versus thin skin, I've already spoken about that. Now, and then thick skin mostly is found in the level of the palms of your hand, and it's much more thicker than the thin skin, which is found in the rest of the body, constituting more of the hair follicles. Now, accessory structure of the skins. So I've spoken about the glands, the hair, sebaceous. The glands are mostly made up of the sebaceous, the eccrine, and the apocrine sweat glands. Now, the development of the skin, you have the skin develops from the ectoderm and the mesoderm because it's constituted of the epidermis and the dermis. The ectoderm is going to develop into the epidermis, the mesoderm is going to develop into the dermis and the hypodermis, and then you have the fusion of both. The merkel discs develop from the neural cells in the ectoderm. So now the next one are the layers of the skin. So these are the different layers of the skin. You can visualize the epidermis, the dermis, and the hypodermis. So in the epidermis is made of the phosphorus squamous epithelium. Then we have the dermis. Inside the dermis you have the eccrine sweat gland that's going to likely have the secretion into the skin. Then we have apocrine sweat gland that have the secretion into the hair follicle. Then you have a particular hair follicle with the hair root, the hair papilla, and then so the hair root and the hair papilla, and then close sealed to the hair follicle you have the ector pili muscle. Then you have the sebaceous gland still close to the hair follicle. Then you have the Meissner corpuscle, which is a sensory receptor just underneath the papilla of the skin. Then we have the free nerve ending. We have the Pacinian's corpuscle, which is more in the hypodermis. Then we have the different nerves endings. Now, these are the layers of the skin. This is the dermis. The dermis is made up of the papillary layer, which is made up of the free nerve ending and the Meissner corpuscle, and the reticular layer, which is at the inferiormost part. And the hypodermis is subcutaneous layer, and it is made up of loose connective tissue, the Pacinian, the adipose tissue, the Pacinian corpuscle, the arteries and veins, and then the nerves. As the structures of the skin, we have the glands, the sebaceous, the eccrine sweat gland, and the apocrine sweat gland. We have hair, which is made up of the shaft and the follicle. Then we have the shaft is the one that is going to be seen with the bare eye. Follicle is the one which is engraved into the skin. Then we have the nails, which was the nail bed, the nail matrix, a ponychium, and the hyponychium. Then you have also the nail plate, so the nail bed, the nail plate, and all that. So you have the sensory receptors. The sensory receptors, you have the Meissner corpuscle, free nerve ending, Pacinian corpuscle, the Merkel cells. The Merkel cells complex or numerical discs. So this is just the layer of the skin. So you can visualize here, these are the horny or the dead cell, the stratum corneum, stratum lucidum here, the stratum granulosum, the stratum spinosum here is made up of polyhedral cells, and then you have the stratum basale here. And the stratum basale here, you have the Langerhans cells, you have the Merkel cells, or in the Merkel disc, we're having the nerve fiber attached to it. We have the dermis here. You can visualize at the level of the dermis. You can also see other melanocytes, and you can see Langerhans cells. So let's visualize the histologic section of a thick skin. So on the thick skin, you can see ducts of the eccrine sweat gland on the thick skin, as you can see here. So these are ducts of the eccrine sweat gland. You have the stratum corneum. These are the papillary. This is the papillary layer, and underneath the papillary layer is the reticular layer. At the level of the papillary layer, like that, at the papillary is the papillary layer of the dermis. Now this is the stratum corneum. All through this is the stratum lucidum, the stratum spinosum, stratum lucidum, granulosum, spinosum, and then the basale, which is close to the papillary layer. Now these are the layer of the skin, see with the hematoxylin and the system. You have the stratum corneum. Here, as you can see here, the stratum granulosum. You need to know that the stratum granulosum contains 3 to 5 layers of flattened keratinocyte filled with keratinohyaline granules, and that keratinohyaline granules is the one that make it to be dark skin on the hematoxylin and the eosin stain. So it contains keratinohyaline granules. So at the level of stratum corneum, you have keratin. At the level of stratum corneum, you also have keratin. But at stratum corneum, the cells are dead and they contain keratin. Stratum lucidum, the cells are still living, containing keratin. But at stratum granulosum, they contain keratohyaline granules that is highly pigmented, is it clear? So that's why it shows it on hematoxylin and eosin stain. It's very dark in the stratum granulosum. Then underneath the stratum granulosum, you have the stratum spinosum, and then at the reticular, so close to the papillae here, we have the stratum basale. Is it clear? So now here is a denser, these are the papillae. So at the level of the papillae, you can see the Meissner corpuscles now, which are close to here. So the Meissner corpus, so these are the dermal papillae with the Meissner corpuscle close to it. Now that diagram was showing the different layers in the thick skin. So now in the thin skin, you don't have stratum lucidum. So what is absent inside the thin skin is going to be the stratum lucidum. There is no stratum lucidum in the thin skin. When the dermis of the thin skin, you can see many. So also in the thin skin, you're going to see many. In the thin skin, you can also see many hair follicles. Is it clear? Because the thick skin is mostly located in the soles of the hand and the soles of the feet. Is it clear? So those are the major part where you have the thick skin. The other part of the body is mostly made up of the thin skin, and those other part of the body consists of many hair follicles. That's why you see sebaceous gland there, you see erector pili muscles. You are going to see in the dermis, and the epidermis do not constitute of the epidermis is not going to constitute of the stratum lucidum. You are going to have the ducts of the sweat gland. As you can see here, you have the eccrine sweat gland, which directly drain into the skin. Then you have the apocrine sweat gland that drains into the hair follicle. So this is the elastic fiber stain. So the elastic fiber stain, you see that we are the thin skin. So the thin skin consists of 4 layers, including stratum basale, spinosum, granulosum, and corneum. There is no stratum lucidum here. Is it clear? And then you need to know that what the elastic fiber can be classified into 3 types. You have the microfiber elastin content. The elastic fiber, largest fiber, contain predominant elastin. So you need to know that there is elastic fiber also in the thin skin, as compared to the thick skin where there is little to no elastic fiber. Is it clear? So at the end, at the papillary surface of the papillary part of the dermis of the thin skin, you have a heavy elastic fiber which is going to stain dark, as you can see here on the thin skin. Is it clear? So you can see it's going to stain there. You're going to have stratum basale also, so that's it. So you have the bud cells, so all these, the cristae cutis. Now there is what you have to know, the cristae cutis. So you have ridges and grooves also on the thin skin, and those ridges and grooves on the thin skin can help you there are grooves, and then there are ridges on the thin skin. Those grooves on the thin skin are called the sulci cutis, as you can see here, sulci cutis, while the ridges on this are called the cristae cutis. On the ridges on the thin skin are called the cristae cutis. They can both be found on the thick and thin skin, and they can be used in the formation of the fingerprint. Is it clear? So that's it. It also consists of keratin here and all that. So these are the basal cells with the cuboidal cells, the basal cells and all that. So the cornified, so on the electron microscopic section, you can visualize a cornified envelope with keratinocytes. Then you have the stratum granulosum, and then the nucleus of the stratum pineosum. Now, what's the clinical correlation? Clinical correlation is squamous cell carcinoma. It's the second most common form of the cancer of the skin. It originates from keratinocyte of the epidermis. So how do you see it on the histology section? You see eosinophilic squamous cell carcinoma cells. Is it clear? So they are also called actinic keratosis. Commonly arises from pre-malignant lesion on the sun-damaged skin. The cancer cells have enlarged and hyperchromatic nuclei with variable differentiation. So that is eosinophilic squamous cell carcinoma. So the next one, you can see keratinocyte in the stratospinosome. So these are the melanin granules, these are the hydrochromatin, the desmosome, keratinocyte with melanin granules and all that. So the next thing to visualize the basal cell carcinoma. Basal cell carcinoma is the most common skin cancer. Is it clear? So the most common skin cancer, you need to, on the histology section, how do you visualize it? It originates from the basal layer of the epidermis and not the keratinocyte part in the stratum corneum, and also occur in the sun exposed areas. So you have lobe of the basal cell carcinoma with squamous differentiation. On the histologic section, lobe of basal cell carcinoma is squamous differentiation. You have peripheral palisading. So you also have peripheral palisade that you can visualize. Is it clear? So the subtypes of basal cell carcinoma are nodular, superficial, pigmented. The subtypes are nodular, superficial, pigmented, and fibrosic. On histologic features, you have lobular growth patterns of the malignant lesion. Now, the spatial type cells of the epidermis. Now, spatial cell type of epidermis, you can have Langerhans cells. You have melanocytes still at the basal and the spinosome area. Is it clear? You can have melanocytes, you can have Merkel cells, you have Langerhans cells. Is it clear? So so you can visualize much of this on the electron microscopic view. So in electron microscopic view, you can see melanin granules of the melanocyte. These are the melanocyte processes. You can see the nucleus of the melanocyte. So all this is melanocyte. This is the collagen fibrils and all that. So clinical correlation of melanocytes now is malignant melanoma. So melanoma is an aggressive malignant skin neoplasm originating from melanocyte of the skin. It is characterized by significant morphologic diversity. So on histology section, you are going to see melanoma cells or tumor cell, and the most common form of melanoma is superficial spreading melanoma and nodular malignant melanoma. So how do melanoma cells resemble? Melanoma cells contain large nuclei. They have irregular contours with prominent nuclei. Is it clear? Now the next one is melanocytic nevus. So usually in French, those melanocytic nevus are called les points de beauté, or in English it can be called moles, beauty points. So in English, so those are the melanocytic nevus. So just some dark spots on your bodies are called melanocytic nevus. Now they can be congenital or acquired and composed of melanocytes in nest or dermal epidermal junction. Is it clear? So when you have those melanocytic accumulation, so on the histology section you have nest of melanocytic cells called nevus. So is it clear? Nest, in a particular nest you have melanocytic cells accumulated. Is it clear? So if they are accumulating now in the dermal cell, in the dermal layer, is going to be called dermal melanocytic nevus. If they are accumulating at the junction between the dermis and the epidermis, they are going to be called junctional nevus. If they are both dermal and accumulation at the junction, they are going to be called compound nevus. Now dysplastic nevus now is going to the one that is going to easily transform to a malignant melanoma, are typically larger than most nevus may be. So when you have a larger big point de beauté, a large beautiful point, so a large nevus, they are larger and they are pre-malignant lesion, are typically larger than most nevus, may have irregular border, pigmentary variation. Then the microscopic representation of dysplastic nevus is going to show dysplastic nevi may show larger junctional nests. They are mostly junctional nests, nevus that fuse to adjacent nests and cytological atypia. Is it clear? So this is the general characteristic to compare thick and thin skin. So if you want to visualize this characteristics, just pause and visualize all this. Then the last thing that they're going to be is the accessory structures of the skin. So for the accessory structure of the skin, you have sebaceous gland. Sebaceous glands are more located in thin and thick skin, but mostly in thin skin. You can visualize sebaceous glands which are close to the hair follicle, which is going to drain into the hair shaft. Then you have the eccrine sweat gland. Now for the eccrine sweat gland, you need to know that they drain directly into the skin, and then they are going to drain water. Water is the most prominent constituent of sweat. The eccrine sweat gland, you have sodium, you have potassium, you have chloride, and you have other metabolic products. Is it clear? Now the secretory unit of the eccrine sweat gland now has two main cell types. It has a dark cell type, which are pyramidal shaped cells, and you have also a clear cell type, which are also pyramidal with no secretory granules. So these are the two main cell types. These are the dark cell type, and these are the clear cell type. The dark cell type has the secretory granules inside, while the clear cell type do not have any secretory granule inside. Lastly, the cell type inside the eccrine sweat gland is going to be the myoepithelial cells, are not secretory cells, but they are spindle shaped cells which have contractile function. So they are going to contract and are going to push the content of the sweat gland outside. Now for the apocrine sweat gland are simple coiled tubular glands like the eccrine sweat gland, but they are in contact now with the hair follicle. Is it clear? Now the secretory cells they are going to produce shedding cells. So see, they are called apocrine because they are shedding the apical part of their cytoplasm. Is it clear? And now when they are shedding the apical part, these glands are mostly called sexual scent glands. Why? Because they produce product. They produce product which are mostly draining on the sexual part, like the axilla, the areola, the nipples, the perianal area, and the genital area are mostly the places where the apocrine sweat gland are going to drain. That's why they are called sexual scent gland, and mostly used in animal in order to call different partners. Is it clear? Now the other thing is that they are going to secrete thick milky fluids that contain protein and ammonia, lipid and carbohydrate, and these secretory fluids are odorless, but they produce certain specific odors when bacterial degradation occur. Is it clear? So now this is a diagrammatic representation of a follicle. So diagrammatic representation of all follicles shows that you have an outer wood sheet, you have an inner wood sheet, you have a hair cuticle, you have a hair medulla, and you have a hair. So you have hair cortex and hair medulla. So is it clear? So this is the histologic section. So this is the hair medulla here. This is the hair cuticle, hair cortex first. Then you have the hair cuticle. Then outside now, which is when inside the skin, we have now the inner root sheet, you have the outer root sheet, and you have the connective tissue. So this hair follicle now is now on the longitudinal section. So on the longitudinal section, you can see an outer root sheet, you see an inner root sheet, you see the hair medulla, hair cortex, hair cuticle, then this is the connective tissue close, then this is the hair bulb at the end here. In the hair bulb, you have the hair root, you have the matrix and the dermal papilla down that you can see. So now in the clinical correlation of the hair, we have androgenic and alopecia. So alopecia is just referred to the falling of hair. So androgenic alopecia is the most common form of hair loss affecting, so the most common form of hair loss affecting 30 to 40% of adult population. Is it clear? Male and female have similar incidence in developing the hair loss, characterized by varying degree of partial hair thinning and then all that. Is it clear? Now it is mostly involved, it can be a genetic or androgenic dependent disorder. Is it clear? So here you can, in androgenic dependent disorder, you can have a 5-alpha reductase, increased production of dihydrotestosterone, testosterone, which is going to bind with the androgen receptor, and that is going to be susceptible follicle to trigger the gene to miniaturize the follicle. So now on the histology section of androgenic alopecia, you're going to have miniaturized follicle. Mostly it is due to a 5-alpha reductase increase that produces high level of dihydrotestosterone. Now the next is because you need to know that the males have less hairs compared to the female. So when you have high level of dihydrotestosterone, you're going to have this miniaturization of the follicles. Now the next one is the nail. So the nail structure, we have the first part is a nail plate, then underneath here you have the hyponychium, above here you have the hyponychium or the nail cuticle, then here you have the nail bed. The nail bed is where the nail plate lies. You have the nail lunula. Lunula is just this small like la lune, just like the moon shape. That's why it's called lunula, nail lunula. You have the nail hyponychium, is just this tissue above. Hyponychium is just the tissue below. Then the nail bed is where the nail plate lies. This is the perionychium, it's just the tissue along the nail. Is it clear? This is the fingertip and all that. Now the nail root. So at the level of the nail root, you have the hyponychium, you have the nail plate, you have the nail bed, and you have the nail matrix inside the nail root. Now normally the clinical correlation is that normally the nail bed is smooth and allow a healthy nail growth and smooth appearance. If a nail is infected by bacterial fungus, the nail bed become rough. An accumulation of organic waste material can react with the nail plate and cause the nail to become thickened and distorted. Is it clear? So now clinical correlation of nail is molluscum contagiosum. It's a viral skin infection caused by molluscum contagiosum virus and a member of pox virus family. Disease is characterized by dome-shaped pearly papules, dimple center. Is it clear? Now you are going to on the histologic section of molluscum contagiosum, you are going to visualize molluscum bodies. This is how molluscum bodies resemble. The slide show lobules of keratinocyte with large eosinophilic. So show lobules of keratinocytes, you can see here, with large eosinophilic intracytoplasmic inclusions. Those intracytoplasmic inclusions are called molluscum bodies. Now the last part of this tutorial is going to be development of the skin. So the skin development is going to develop into two layers, the epidermis and the dermis. Is it clear? So the epidermis develop from the ectoderm and dermis develop from the mesoderm. Is it clear? Now the mesoderm is going to, so the basement layer over the mesenchymal tissue. So we need to point out the fact that after 5 weeks, the epidermis has 2 layers of cell. That is the superficial, is going to divide into 2, the superficial layer and the basal layer at 5 weeks of gestation. Now at 2 to 3 months, the basal cell layer is dividing rapidly and the epidermis becomes several layers thick. Is it clear? At first 5 weeks divided into 2, which is superficial layer and the basal layer. Then the basal layer at 2 to 3 months divide multiple layers to produce several cell layer thick epidermis. At the same time, the mesenchymal cells in the mesoderm now differentiate into more mature connective tissue. By 4 months, the neural crest cells now migrate to the basal layer and differentiate into the melanocytes and Merkel cells. The Merkel cells are the ones that are going to be involved as nerve endings for the receptors, and then the melanocytes are going to produce pigmentation. All these come from the neural crest cells at 4 months. Is it clear? The epidermis and the epidermis and differentiate into the melanocyte. The connective tissue layer beneath the epidermis develop into the dermis, and the deep layer the hypodermis. So at the mesenchymal cells now going to produce the dermis and the hypodermis. At about 5 months, the appendage of the skin, that is hair follicle, the glands start to be formed. Now the next thing is the fetal skin. For the fetal skin, is going to be produced at the level of the 5th month. So this section is going to show the fetal skin. So this is the basal layer at first, and this is the peridermal layer. The basal layer is the one that's going to divide multiple to produce the several layers layer thick of the epidermis. Then you have the mesenchymal cell, that's going to produce the dermis and the hypodermis. We also have the neural cells which come from the ectoderm, that's going to produce the differentiation to the melanocytes and then the Merkel cells. Now this is at the 5th month. So at the 5th month, this is 5 to 9 weeks. This is now at the 5th month. So at the 5th month now you have this cell tissue. Is it clear? With the basal cells, they are accumulated and all that. So from here, I say thanks for your kind attention, and don't forget to like and subscribe for our channel. Thanks very much.